estimated 6.5 million people die from stroke each year, making it the fifth leading cause of death in the United States and the second leading cause worldwide, just behind heart attacks. The good news is, many of these deaths are preventable. Strokes often give warning signs before they happen. The key is recognizing them and acting fast. In today's video, we'll discuss 9 critical stroke warning signs you should watch out for. We'll also give you important tips and the emergency steps you need to take if you suspect someone is having a stroke. Let's get started with the first critical warning sign you should be aware of: one-sided sudden numbness or weakness. One of the most common and recognizable signs of a stroke is sudden numbness or weakness, especially on one side of the body. This can affect the face, arm, or leg, and often comes on unexpectedly. According to the American Stroke Association, about 80% of strokes result in some form of one-sided weakness or numbness. This occurs because most strokes affect one hemisphere of the brain, which controls movement and sensation on the opposite side of the body. In fact, a stroke in the right side of the brain typically leads to weakness or numbness on the left side of the body, and vice versa. Here are key symptoms to watch for: one side of your face drooping or feeling numb, weakness or numbness in one arm, making it hard to lift or hold objects, difficulty raising both arms evenly, one arm may drift downward, weakness or numbness in one leg, often making it hard to walk. These signs are your body's way of telling you something is wrong. Time is critical. The Centers for Disease Control and Prevention, CDC, estimates that nearly 2 million brain cells die every minute during a stroke. Acting fast can save lives and reduce long-term damage. If you or someone else experiences sudden numbness or weakness on one side of the body, don't wait. Call emergency services immediately. Early treatment can make all the difference in recovery. The next critical sign is sudden confusion or trouble speaking. A stroke can directly impact the brain's language centers, causing sudden confusion, difficulty speaking, or trouble understanding speech. This condition is called aphasia, and it can range from mild difficulty to a complete inability to communicate. Signs to watch for include slurred or garbled speech, using the wrong words or speaking in a way that doesn't make sense, inability to form clear, coherent sentences, difficulty understanding what others are saying. Aphasia occurs when a stroke affects the areas of the brain responsible for language processing, typically in the left hemisphere. According to the National Aphasia Association, about 25 to 40% of stroke survivors develop some form of aphasia. It's crucial to note that these changes often happen suddenly and without warning. Any abrupt difficulty with speech or comprehension should be treated as an emergency. As with other stroke symptoms, immediate medical attention is critical. The quicker you act, the better the chances of minimizing brain damage and improving recovery. Before we move on to the next critical warning sign, let's take a step back and make sure we understand what a stroke actually is. A stroke happens when the blood flow to part of your brain is blocked or reduced, meaning the brain cells don't get the oxygen and nutrients they need. Without oxygen, brain cells start to die, which can cause permanent damage. There are 2 main types of strokes. Ischemic stroke. This is the most common type, making up about 87% of all strokes. It happens when a blood clot blocks a blood vessel in the brain, cutting off the oxygen supply. Hemorrhagic stroke. This happens when a blood vessel in the brain bursts, causing bleeding into the brain tissue. This type of stroke is less common but can be very dangerous. So who's at risk for stroke? Well, anyone can have a stroke, but some factors make it more likely. These include high blood pressure that isn't controlled, smoking, diabetes, high cholesterol, obesity, or being overweight, not exercising enough, heart disease, and family history of stroke. Having one or more of these risk factors doesn't mean you'll definitely have a stroke, but it does increase your chances. The more risk factors you have, the greater the risk. The good news is that many of these risk factors can be changed or managed. For example, you can quit smoking, start exercising more, lose weight if you need to, and make sure to control your blood pressure, blood sugar, and cholesterol levels. By making healthy changes and managing these conditions, you can reduce your risk of having a stroke and improve your overall health. Now let's move on to the next critical sign of stroke: sudden vision problems. Sudden changes in vision are another key warning sign of a stroke. This can happen without warning and might show up as sudden blurred vision, double vision, seeing two images of one object, partial or complete loss of vision in one or both eyes, difficulty focusing or tracking moving objects with your eyes. Vision problems occur because a stroke can damage the parts of the brain responsible for processing sight or affect the nerves that control eye movement. The brain's occipital lobe, which is responsible for vision, or the optic nerve can be affected during a stroke, leading to these issues. According to the American Stroke Association, about 30% of stroke survivors experience some form of visual impairment. This can include partial vision loss, double vision, or difficulty with depth perception. In some cases, vision may improve over time, but in others, the damage may be permanent. A study published in Stroke Research and Treatment found that vision-related problems after a stroke can significantly impact quality of life and may also delay rehabilitation. The study showed that patients with vision issues after a stroke had a harder time recovering compared to those without. It's important to understand that even if vision problems seem to clear up quickly, they should never be ignored. Temporary vision disturbances, known as transient ischemic attacks, TIAs, are often referred to as mini-strokes. TIAs are warning signs that a major stroke could be on the way, and they require immediate medical attention. Research shows that up to 15% of people who have a TIA will experience a full-blown stroke within 3 months. So if you or someone around you suddenly experiences vision problems, whether it's blurry vision, double vision, or difficulty focusing, treat it as an emergency. Getting medical help quickly could prevent long-term damage or even save a life. The next critical sign to watch out for is sudden dizziness or loss of balance. A stroke can interfere with the brain's ability to control balance and coordination. When this happens, it can lead to symptoms like sudden dizziness or vertigo, where you feel like the room is spinning even though you're not moving, loss of balance or coordination, difficulty walking or standing upright, unexplained falls or stumbling for no obvious reason. These symptoms are often seen in strokes that affect the brainstem or the cerebellum, the parts of the brain responsible for balance, coordination, and muscle control. Strokes in these areas can be particularly dangerous because they control essential functions like breathing and heartbeat. According to the National Institute of Neurological Disorders and Stroke, strokes involving the cerebellum or brainstem can account for up to 20% of all strokes, and dizziness or loss of balance is a common symptom. It's important to note that vertigo associated with a stroke tends to be milder than vertigo caused by inner ear issues, but it is often more serious. Unlike ear-related vertigo, which can come and go, stroke-related vertigo usually appears suddenly and doesn't improve without treatment. A 2014 study published in Neurology found that about 3 to 4% of people who visit the emergency room for dizziness or vertigo are actually experiencing a stroke. This highlights the importance of not brushing off sudden dizziness or balance issues as a minor problem. These symptoms could signal a major medical emergency. The next critical sign of a stroke is sudden severe headache. While not every headache is cause for alarm, a sudden severe headache with no clear cause can be a warning sign of a stroke, especially if it's unlike any headache you've ever had before. People often describe it as the worst headache of their life. This type of headache can also come with neck stiffness, facial pain, and vomiting. These symptoms are particularly associated with hemorrhagic strokes, which occur when a blood vessel in the brain bursts, causing bleeding into brain tissue. Hemorrhagic strokes are less common than ischemic strokes, but can be more deadly, making it essential to get medical attention immediately. According to the American Stroke Association, about 13% of strokes are hemorrhagic, but they account for a disproportionate number of stroke-related deaths. The sudden onset of a severe headache is one of the most recognizable signs of this type of stroke. Another warning sign of a stroke, though less commonly recognized, is the sudden onset of nausea or vomiting. This is especially true when it happens alongside other stroke symptoms, like dizziness or a severe headache. Nausea and vomiting are more frequently linked to strokes affecting the brainstem or cerebellum, areas responsible for balance, coordination, and essential bodily functions. A stroke in these areas can disrupt the normal signals sent to the digestive system, leading to nausea and vomiting. A study published in Stroke and Vascular Neurology found that while nausea and vomiting aren't as commonly discussed stroke symptoms, they should not be overlooked, especially when they occur suddenly and without another clear cause. If you or someone you're with experiences sudden, unexplained nausea or vomiting, particularly alongside other stroke symptoms, seek immediate medical attention. Every minute counts. Before we dive into the remaining critical signs, let's take a moment to understand why recognizing these warning signs is so important and why it's crucial to act fast. When it comes to strokes, every single minute counts. The faster we can spot and treat a stroke, the better the chances of recovery. Our brains are like gardens. When a stroke happens, it's like a part of that garden isn't getting water. The longer that section goes without water, the more plants begin to wither and die. In the same way, when a stroke cuts off blood flow to the brain, the longer it goes untreated, the more brain cells are lost. This is why it's so important to recognize the signs of a stroke early. Some of the most common and critical signs to watch for include face drooping, arm weakness, and speech difficulties. These signs indicate an emergency situation, and immediate action is key. If you notice any of these symptoms, don't hesitate. Call for help right away. The faster treatment begins, the better the chances of reducing damage to the brain and improving the outcome for the person affected. Let's get back to our list of critical signs of a stroke with sudden drowsiness or altered consciousness. A stroke can cause sudden changes in level of consciousness. This may include unusual drowsiness or difficulty staying awake, confusion or disorientation, fainting or loss of consciousness. These symptoms can indicate a large stroke or one affecting critical areas of the brain. Remember, any abrupt change in consciousness level requires emergency evaluation. Another sign you should be looking out for is sudden sensory changes. Beyond numbness, stroke can cause other sensory disturbances, tingling or pins and needles sensations, loss of sensation in parts of the body, and altered perception of touch or temperature. These symptoms often accompany weakness on the same side of the body. These may not seem as bad, especially if they are experienced on their own, but they should not be overlooked. Any sudden, unexplained sensory changes should be evaluated promptly. Sudden difficulty swallowing. Dysphagia, or trouble swallowing, can be an overlooked sign of stroke. Symptoms may include difficulty initiating swallowing, choking or coughing when trying to swallow, and feeling like food is stuck in the throat. This symptom is particularly concerning as it can lead to aspiration pneumonia if not addressed. Any sudden onset of swallowing difficulties should be treated as a potential stroke symptom. In addition to recognizing the warning signs, it is also important that you act quickly when a stroke is suspected. It's crucial to remember the acronym FAST, which stands for face drooping, arm weakness, speech difficulty, time to call for help. Time is critical in stroke treatment. For every minute a stroke goes untreated, an estimated 1.9 million brain cells die. The sooner a stroke is recognized and treated, the better the chances of survival and recovery. That's why it's vital to call emergency services immediately if you or someone around you experiences any of the warning signs we discussed today. Remember, stroke symptoms typically come on suddenly and can vary in severity. Even if symptoms seem to improve or resolve on their own, it's crucial to seek emergency medical care. A transient ischemic attack, TIA, or mini stroke can produce temporary symptoms, but still requires urgent evaluation, as it often precedes a full stroke. By being aware of these critical warning signs and acting quickly when they occur, you can play a crucial role in improving stroke outcomes and potentially saving lives. And there you have it, critical stroke warning signs before it happens. We hope you found this video both informative and helpful. If you enjoyed this video, please don't forget to give it a thumbs up, share it with friends, and subscribe to our channel for more educational content on health and wellness. Your support helps us continue creating valuable content and raising awareness about important health topics. Now, we'd love to hear from you. Have you or someone you know experienced any of these stroke warning signs? Share your insights or experiences in the comments below. Your input is invaluable and helps us build a stronger, more informed community. Remember, Recognizing the early warning signs of a stroke can save lives. By staying informed and acting quickly, you can reduce the risk of severe damage. And if you'd like to show your appreciation, please consider sending us a super thanks. Your support allows us to continue creating content that raises awareness about crucial health issues. Thanks for watching, stay safe, and we'll see you in the next video.